We are continuing on with our new terminology, and today what we are going to be looking at are different landmarks on the body and different body cavities. So the anatomical body landmarks are going to be used to identify different surface features of the body. We have both anterior and posterior landmarks. So if you remember from yesterday, anterior refers to the front of the body or more in front of another structure. Posterior refers to the back or more behind another structure. So the anterior landmarks will be on the front of the body and posterior landmarks will be on the back of the body. There's also one inferior body landmark, and we will talk about that after we cover all of the things that you see on these two diagrams. So we're starting with anterior body landmarks, and you have these same things, these same boxes on your note slide. So we're going to use those to help us label these diagrams, and I'll be doing that as we go through the lesson, so you'll need to make sure you label them on yours as well. First we have abdominal, so that's going to be anterior, the anterior body trunk, inferior to the ribs. So anterior body trunk, this would be the body trunk, and it's inferior to the ribs, so the ribs would be around here, so that means that this section right here would be referred to as abdominal. So we can drag our label there. Acromial is the point of the shoulder. So if we look at both shoulders, the point of the shoulder would be up here. So if we go ahead and drag acromial to that top line, that will label that for us. Next we have antebrachial. Antebrachial means your forearm, so between your elbow and your wrist. Okay, we have a line right here pointing to that for us. So if we drag that label over there. Antecubital is the anterior surface of the elbow. So one thing we need to keep in mind, and you can see it in the diagram, is that all of these are referring to places as if the person is in an anatomical position. So if we remember back to yesterday, anatomical position is standing erect or upright, palms facing forward, feet facing forward, like the person in the diagram is. Okay, so the anterior surface of the elbow, when you bend your elbow, if you were going to, let's say, bring your hand up to the palm of your hand up towards your shoulder, that part of your elbow where it's bending and those your lower arm is coming closer to your upper arm, that's going to be the anterior surface of your elbow. So that would be right here or right here. And we can see that that line is just above where we put antebrachial. So we can put antecubital there. Next we have axillary. Axillary refers to the armpit. So below each arm, and we have a label, a line to label right here for axillary. So again, you can see it's pointing to this small section here, and that's also outlined there. Next, we have brachial. Brachial just refers to the arm, so, or the upper arm, really. So we will have that right there. And then next, our last one on this slide is buccal or buccal, which refers to your cheek. And we have that right there. Okay, so the cheek on the face would be that label right there. Okay, if we move on, and these are just, I'm just giving these to you alphabetically. Our next landmark that we have is carpal. Carpal refers to the wrist. If you've ever heard of someone getting carpal tunnel syndrome, that's an issue with the nerve in their wrist. And so carpal refers to the wrist. If we look right here, we have that label line pointing to the wrist. Cervical is going to be the neck. So if you've ever had health and you learned the different bones in health class, your cervical vertebrae, or the vertebrae that are in your neck, you have 7 of them. So that would be this line right there, okay, pointing to the neck. Next we have coxal, which is your hip. So if we see, we have right here and right here, so this line would be for coxal. Okay. Next we have crural. That refers to your leg, the front of your lower leg, really, or your shin. So that would be this one right here. Okay, so the front of your leg. Deltoid is the curve of the shoulder. So don't get deltoid and acromial confused. Acromial is the very top point part of the shoulder, Just below that would be deltoid. So your shoulder muscle, the cap of your shoulder, is a deltoid muscle, which is where this name comes from. A delta is a triangle. So part of where the deltoid muscle got its name from is from the fact that it's triangular shaped. So this second line down on that side is for deltoid. Now you see here I have two labels for you to do digital, and that's because digital refers to your fingers and your toes. So we're going to label both of them. Right here you have a line pointing to the finger, and down here you have pointing to the toes. So it doesn't matter which one you put where, but you're going to label both the fingers and the toes. Our last one for this slide is femoral, which is your femur. If you think of your femur bone, your thigh bone, okay, here and here would be femoral. So this line right below coxal for hip would be where we need to put femoral. Okay. You do need to be kind of careful because some of the label lines are kind of close to each other. They overlap a little bit. So just make sure, like if you see how I move femoral, actually I might move it over a little bit even more. Just to help the lines be more clear what boxes they're going to. Okay. You do have these notes. They are going to stay in your Google Drive, even though you're submitting them on Schoology. So they are here for you to refer back to. So that's, you want to make sure you have these labeled correctly, for that reference, but you also, part of your grade for your notes today is that you're doing this right. So you want to make sure for both of those, your grade and for you to study from, you want to make sure that they're accurate. Okay, so next we have fibular. If you think of the fibula, the bone on the outer part of your lower leg or the lateral part of your lower leg, that would be where your fibula is. So this label right here would be fibular. Frontal refers to the forehead. So right here pointing to the forehead would be frontal. Next, we have inguinal, which is the groin. That is going to be right here. Okay, so this area right here would be the groin, which is inguinal. Next, we have mental, which is the chin. So right here, this line is pointing to the chin. So we want to label that. Nasal is the nose. So this line here would be nose. Try and move that a little more. Okay, there we go. That didn't really help, did it? There we go. Okay. Next we have oral, which is the mouth. So the reason why I'm trying to make this one smaller, if I can, we're also going to need to fit oral for mouth in there. And let me make that a little smaller for myself too. So you can change the size on yours as well, just to make it more clear. Okay. And then orbital would be in reference to your eyes. So we need to squeeze this one in. And again, you can make your boxes smaller. Maybe, if I can make mine smaller. You know what? That kind of works, I guess. All right, so make sure you have all of those labeled on yours as well. That's probably the hardest one since there's so many on the face on that slide. Still going on with, these are going to be our last of the anterior body landmarks. Patellar is the anterior, the front of the knee. So your kneecap, that bone is called the patella. So that region is the patellar region. We want to add that label here. Pelvic is the front of the anterior pelvis. So right here, okay, is pelvic, this kind of purple highlighted region right here. Okay. Make sure you're not using this line there because that was inguinal that we didn't use on this slide. We used it on an earlier slide. Next we have pubic, which is the genital region. So that would be right here. Sternal, if you know, again, any of the bone names, the sternum is your breastbone. So this region right here would be the sternal region, and we can label that. Okay. Tarsal, your tarsal bones are your ankle bones, so we need to label the ankle with tarsal. Thoracic is the chest, so that actually isn't going to be a separate label. Where we're going to put that one is just kind of over the middle, okay, over the orange. That would be kind of like a heading for, like sternal would be part of the thoracic, okay. And then umbilical is the navel or the belly button. So that would be this label right here above pelvic, okay. So those are all of the anterior body landmarks. Now we're going to move on to the back of the body or the posterior landmarks. Our first one here, again, these are just alphabetical, is calcaneal. Calcaneal is the heel of the foot. So that would be right there. Okay, it's pointing at the heel of the foot. Cephalic is the head, just like we did thoracic on the front. That's more of a heading. So we are just going to put cephalic right there above the head. Okay. Femoral, so some of these you can see on the front and back of the body. Femoral is the thigh still, where the femur would be. Gluteal is the buttocks. So if you have heard of gluteus maximus, gluteus minimus, those are your butt muscles. So gluteal would be the buttocks region. Lumbar is going to be in your lower back, between the ribs and the hips. So this area here on either side of the spine, that would be lumbar. Those vertebrae there are called your lumbar vertebrae. You may have heard of different chairs or like seats in cars having lumbar support. That just means it's giving lower back support. Our last one for this slide is occipital. That is at the back of the head, or the base of the skull. So if you've ever learned the lobes of the brain before, your occipital lobe of your brain is the back of your brain. So the bone that covers that is the occipital bone, that part of your skull. So that region is called the occipital region. The rest of our posterior body landmarks, we have olecranal. That is the posterior surface of the elbow. So when you bend your elbow, the part that's pointy is olecranal. So it's going to be this label right there. Let's see. Sorry guys, let me fix that. There we go. Popliteal is the back of the knee or the posterior side of the knee. So that would be right here on either side. We need to move that label. Sacral, again, if you've learned the bones, the sacrum is at the base of your spine. It's not the last bone of your spine, but it's close. And that's going to be the area between the hips. So right here, this kind of triangular region would be sacral. Scapular refers to the scapula or the shoulder blade, okay, which would be here. And then we have two left. Sural refers to the calf. So that's going to be right here, this line for your calf. And then vertebral is your spinal column. So that would be this section right there. Okay, so again, make sure you have all of those labeled on your notes. And then we have, excuse me, one inferior body landmark. Inferior means below or closer to the bottom of the body. This person is standing on their toes in this diagram so that we can see the plantar region. If you think of plantar as in you plant your feet on the ground. the sole of your feet, the bottom of your feet, is the plantar region. So that would be down here. Let me fix that again. There we go. Okay. I'll already have that taken care of for you on your notes, so you don't need to worry about that. So plantar, again, is the bottom of your feet, and the way I remember that is you plant your feet on the ground. Plantar is the soles of your feet, where you would plant your feet on the ground. Okay. The last thing we have to go over today are body cavities. A body cavity is just an empty space in a solid object, and they're going to be filled by organs in our bodies. There's two main body cavities, the dorsal body cavity, which you can see kind of in orange here, and then the ventral body cavity, which on this same part of the diagram looks purple, pink, and green. Okay, so we're going to start with the dorsal body cavity, and that has two subdivisions. It has the cranial cavity, which houses your brain, and it has the spinal cavity, which houses your spinal cord. Okay, there are bones around those. Those are very important organs, so we want them protected. So the cranial cavity itself is this hollow space, but it's filled by our brain. And then the spinal cavity is a hollow space in between the vertebrae where your spinal cord would be. And again, that offers protection for your spinal cord. Finally, we have the ventral body cavity. This is much larger than the dorsal cavity. It's got a lot more organs in it and a lot more components. So there are two main subdivisions of the ventral body cavity. You have the thoracic cavity and the abdominopelvic cavity. The thoracic cavity is going to contain the lungs and the heart. Okay, so that would be up here. It is separated from the rest of the ventral body cavity by the diaphragm. The diaphragm would be right here, or we can even see down here where it's labeled. Okay, so the thoracic cavity is separated by the sheet of muscle, which is the diaphragm. And then the thoracic cavity itself can also be further divided into left and right by an area in between called the mediastinum. The abdominopelvic cavity has a lot of organs in it. So we further divide that into the abdominal cavity and the pelvic cavity. The abdominal cavity has your stomach, your liver, your intestines. So you can see that's pink on each one here, highlighted in pink. And then the pelvic cavity is highlighted in green on the diagram. That contains the reproductive organs, bladder, and the rectum. Okay, so that will be where we kind of hit pause for today. You do have notes that you should be filling out. Hopefully you did that while you were watching the lesson. If not, you'll need to go back and do that. You'll have some things to fill in, so type in, and then you'll need to do the labeling that we did if you didn't take care of that while you were watching the lesson. You also have a practice assignment to do once you're done this for today, just to get you used to some of these terms and where they're located. If you have questions at all, please reach out and let me know. You can come to a Zoom session or send me a message on Schoology, and I would be more than happy to help you. Have a wonderful day, everyone.